If you're a gentleman over the age of 60 and you believe that daily self-pleasure is without consequence, I would encourage you to reconsider. What if I were to tell you that this practice, something you may have never given a second thought, could be quietly contributing to the very prostate issues that are disrupting your sleep, weakening your flow, and gradually taking over your life? It might seem drastic, perhaps even uncomfortable to hear, but as a physician specializing in prostate health, I've personally witnessed how this single daily habit can shift the balance from manageable symptoms to a disease that significantly impacts your life. I'm Dr. Anya Sharma, a board-certified urologist and men's health expert with more than 30 years dedicated to caring for men as they age, right here in America. My life's work is to help men over 60 regain their strength, their self-assurance, and the joy they deserve. And I'm not here to scold you. My aim is to share with you the honest truth that your regular doctor might be too uncomfortable or too pressed for time to discuss openly. For many years, we were led to believe that ejaculation was always beneficial for the prostate. However, the reality is more complex. Indeed, it can be helpful when practiced with intention, moderation, and self-awareness. But when it becomes a compulsion, excessively frequent, or driven by emotions, it starts to quietly irritate the prostate, disturb hormonal balance, and intensify urinary symptoms. That's the aspect that often goes unmentioned. In this video, I'm going to carefully explain what exactly happens within your body when this habit is left unchecked, and more importantly, what alternative actions you can take. You'll discover 5 habits, endorsed by doctors, that will not only safeguard your prostate but also dramatically enhance your sleep, vitality, and confidence, starting this very week. And please stay with me, because later on, I'll guide you through a quick 10-second test you can do at home to determine if your prostate is already under duress, even before the symptoms become severe. Let's begin. Before we get started, please be sure to click that subscribe button and turn on notifications so you won't miss any crucial advice on how to protect your prostate and improve your well-being after 60. And if this topic resonates with you, please type 1 in the comments. If not, type 0. Your input helps me to create better, more tailored content just for you. Now, let's begin with the first habit that's often overlooked by many men, yet it silently damages your prostate each and every day. It may seem harmless, even commonplace, but holding your urine can lead to significant long-term consequences. Here's what actually occurs within your body when you do this. First, avoid holding your urine. It's detrimental to your prostate. I can't tell you how many times I've sat across from a gentleman in his 60s or 70s, listening to him describe the constant need to urinate during the night, the weak flow, the sudden urges during the day. And then, he'll say something like, "But that's just a part of getting older, right, doc?" And each time, I gently shake my head and say, "Not necessarily. Sometimes it's your own actions that are making it worse." One of the most disregarded, yet profoundly harmful habits that contributes to prostate issues is something we were all taught to do as children, holding it in. Whether you're caught in traffic, sitting through a meeting, or simply feel that a restroom isn't readily available, you tell yourself, "I can wait a little longer." But that waiting, over time, becomes a significant problem. Your bladder isn't designed to stretch indefinitely. When you consistently ignore the need to urinate, especially as you age, the bladder walls begin to weaken and lose their elasticity. It becomes more difficult to empty completely, leading to residual urine remaining in the bladder, stagnant, irritating, and occasionally even infected. But here's where it directly affects your prostate. When the bladder becomes overstretched, it puts pressure on the prostate gland, which sits directly beneath it. That constant pressure contributes to swelling and inflammation, and over time, it makes symptoms like frequency, urgency, and nighttime awakenings significantly worse. It's not merely about discomfort, it's about your long-term health. A prostate under constant strain becomes more susceptible to enlargement and more challenging to manage without surgery. Many men don't realize that benign prostatic hyperplasia, BPH, can be significantly worsened by this single habit alone. The unfortunate aspect is that holding your urine seems like such a minor action. It's something you barely even consider, but biologically, it triggers a cascade of stress throughout your entire lower urinary system. And I understand. I've spoken with veterans who were raised to endure, farmers who worked extended hours and didn't have time to stop, fathers and grandfathers who put aside their own comfort for others. The habit becomes ingrained in your identity until the day your body can no longer keep up. That day often arrives in the form of frequent nighttime awakenings, the urgency that strikes before you can find a restroom, or that moment when you begin to leak before you can even unfasten your trousers. It's not a sign of weakness. It's your body signaling that it's had enough. And as your doctor, I need you to heed that signal. So, what's the solution? It's not complicated. It begins with a simple decision. When you feel the urge, go. Don't delay. Even if it's inconvenient, even if it doesn't seem urgent. If you're over 60, your bladder isn't as resilient as it once was, and your prostate is more sensitive to pressure. Each time you hold it, you're training your body to disregard its natural signals, and eventually, it will stop sending them altogether. That's when the damage becomes more difficult to reverse. Take this seriously. Even if you're currently managing well, this habit develops gradually, silently. And here's something you might not be aware of. If your bladder becomes chronically overfilled, it can actually stretch the urethra and cause nerve dysfunction, making it more difficult to sense fullness and control the flow. That's a situation no man wants to experience. So, if you're someone who has been dismissing the urge to urinate, convincing yourself that it's all right to wait, consider this your wake-up call. Begin to respect the signals your body sends. It may seem like a small adjustment, but it can lead to a significant improvement in your comfort, confidence, and long-term prostate health. And speaking of habits that may appear harmless on the surface but have hidden consequences, let's discuss one that's even more personal and vastly misunderstood: your relationship with self-pleasure. What you're about to hear may completely change the way you view this aspect of your health. Second, self-pleasure. Is it helpful or harmful after 60? This is the point where most men become a bit uneasy. I've had countless conversations with patients over the years, and when the topic of self-pleasure arises, there's often a noticeable pause. Some chuckle awkwardly, others look away, unsure if it's even appropriate to ask. And yet, deep down, they all want to know, is it benefiting me or harming me? Let me be candid with you. This question is one of the most crucial and misunderstood in men's health, particularly after the age of 60. And I say that not just as a doctor, but as someone who has witnessed men's lives change, both positively and negatively, based on their relationship with this deeply personal habit. For decades, the message was straightforward: self-pleasure is natural and harmless. And in many respects, that's true. In fact, one of the most comprehensive studies ever conducted on prostate health, carried out at Harvard, followed over 31,000 men and discovered that those who ejaculated more than 21 times per month had a significantly lower risk of developing prostate cancer. The scientific evidence suggests that regular ejaculation helps to flush out old prostate fluid, reduces congestion, and even lowers inflammation. It's like a gentle internal cleansing that keeps things moving and functioning smoothly. But here's where it becomes more nuanced, and this is the part that's often omitted. Frequency alone doesn't tell the whole story. It's not just about how often you do it, but also why, how, and how you feel afterwards. I've encountered men in their 60s and 70s who engage in self-pleasure daily and feel energized, relaxed, and balanced. I've also seen men who do it the same way, with the same frequency, but end up feeling depleted, sore, anxious, and even ashamed. That's when it becomes problematic. When self-pleasure becomes compulsive, when it's driven by boredom, loneliness, or stress rather than genuine desire, it begins to take its toll. It can lead to pelvic tension, irritate the nerves surrounding the prostate, disrupt your natural hormonal rhythm, and in some instances, even contribute to erectile dysfunction or chronic prostatitis symptoms. It can also affect your emotional well-being, leaving you feeling empty or disconnected. And here's something I often share with my patients, especially those who've incorporated this into their daily routine without much thought: your body changes as you age. What you could do in your 30s or 40s without any consequences may not feel the same in your 60s. The tissues around the prostate become more sensitive. The nerves that govern sexual function become less forgiving. And your recovery time after orgasm lengthens, particularly if your testosterone levels are lower. So, the very habit you believe is keeping you youthful might actually be depleting your reserves. Now, please don't misunderstand me. I'm not here to pass judgment. In fact, I believe that healthy, intentional sexual expression is an important aspect of life at every age. However, I am urging you to listen to your body. Ask yourself, do I feel energized afterwards, or drained? Is this bringing me peace, or simply filling time? These questions are more important than you might realize. If you feel relaxed and restored afterwards, you're likely doing it in moderation. But if you're noticing pain, fatigue, or emotional lows, it might be time to take a brief break, reevaluate your relationship with the habit, and observe how your body responds. Many men are surprised by how much sharper, calmer, and stronger they feel after just a few days of abstinence. So, yes, self-pleasure can support prostate health, but only when practiced with awareness and moderation. It's not about stopping, it's about taking control. Like any aspect of your health, it deserves intention, not autopilot. And now that we've discussed what's happening inside your body on a hormonal and neurological level, it's time to address something even more fundamental, your daily water intake. Because most men are unknowingly sabotaging their prostate simply by how, when, and how much they drink. And the solution? It's simpler than you think. Let me explain. Third, hydration strategy, drink, but drink correctly, not just more. Over the years, I've had countless men sitting in my office, feeling frustrated, exhausted, and confused. They're tired of waking up 3 or 4 times a night to use the bathroom. They're weary of the constant urge to urinate during the day, always feeling like their bladder is never quite empty. And often, one of the first things they tell me is, "Doc, I've been drinking more water, like everyone says. Isn't that supposed to help?" Here's the truth, and I share this with all the care and experience I've gained over decades of treating prostate issues. It's not just about drinking more water, it's about drinking water in the right way. That subtle difference can be crucial when it comes to your prostate health. Let me tell you about one of my patients, John, a 68-year-old retired school teacher. He came to me with classic symptoms, urgency, frequency, and multiple nighttime awakenings. He was following all the healthy advice, drinking close to 10 glasses of water a day, staying hydrated, as he put it. But the timing, that's where things went wrong. John would consume most of his fluids in the afternoon and evening, and then spend the entire night paying the price. He didn't require medication. He didn't need surgery. He needed a strategy. And once we adjusted when and how he hydrated, everything started to improve. You see, as we age, our bodies become more sensitive to fluid balance. Our kidneys don't filter quite as efficiently. Our bladders don't stretch and contract as they used to. And our prostates, well, they tend to grow and press against the urethra, making every little drop of urine feel like a full tank. When you overload your system with water, particularly in the second half of the day, you're creating a storm of urgency and disrupted sleep. That doesn't mean you should stop drinking. It means you should start being mindful. The goal is to distribute your water intake throughout the day in small, steady amounts. Think of it like watering a plant. Too much all at once, and the soil floods, but a little bit at a time. That's how roots thrive. Begin your day with a glass of water within 30 minutes of waking. Then, sip steadily every hour or so, tapering off by early evening. I typically advise my patients to stop major fluid intake by 7 p.m. That doesn't mean you should go thirsty. It simply means you're giving your bladder a chance to settle before bedtime. The result, fewer nighttime trips, deeper sleep, and a bladder and prostate that finally get to rest. And here's something most men don't realize. When you're mildly dehydrated, which many older men are, you produce more concentrated urine. That darker, stronger-smelling urine is more acidic and can irritate both the bladder and the prostate. Over time, this irritation leads to inflammation, which worsens symptoms like urgency and discomfort. But when you stay consistently hydrated during the day, your urine becomes lighter, less irritating, and far easier on your urinary system. It's not just what you drink, it's when, how, and how consistently you do it. I can't emphasize that enough. Hydration is medicine when done correctly, and a hidden stressor when done incorrectly. So, if you've been flooding your system late in the day, gulping water after dinner, or only hydrating when you feel thirsty, it's time to change that pattern. Your prostate will be grateful, and so will your sleep. And speaking of gentle habits that offer powerful benefits, the next one might surprise you. It takes just 10 minutes, doesn't require any equipment, and has been shown in studies to significantly reduce prostate-related symptoms. I'll give you a hint. It happens after every meal. Ready to discover what it is? Let's continue. Fourth, walk after meals, a 10-minute cure. When most men consider protecting their prostate, prostate, they typically think of supplements, medications, or perhaps cutting back on red meat. Rarely do they consider something as simple as walking. And yet, after all my years of treating prostate conditions in older men, I can tell you this: taking a short walk after meals is one of the most overlooked, low-effort habits that can yield powerful results. I've seen it transform the lives of men who once believed their only options were pills or surgery. I remember a patient named Frank. He was 72, widowed, and had recently started noticing more urgency, more nighttime trips to the bathroom, and just a general sense of discomfort in his pelvic area. He wasn't enthusiastic about the idea of taking more medication, and to be honest, neither was I. So, I asked him a simple question: "Frank, what do you usually do after dinner?" He shrugged and said, "I sit in my recliner and watch TV, like always." That one sentence revealed everything. So, I gave him a different prescription, not a pill, but a practice. I asked him to take a 10 to 15-minute walk after lunch and again after dinner. Nothing fast, nothing intense, just a steady, gentle stroll. 3 weeks later, Frank came back to my office with a smile on his face. "Doc," he said, "I'm sleeping better, I feel lighter, and I don't have to pee every hour anymore." All that from just a few minutes of movement. Why does it work? Because walking improves circulation, particularly to the pelvic area. Better blood flow means more oxygen and nutrients delivered to the prostate and surrounding tissues. It helps reduce inflammation, improve metabolic function, and support hormonal balance, particularly testosterone, which plays a key role in prostate health. And it's not just about blood flow. Walking after meals also helps regulate blood sugar, which is crucial. Men with high blood sugar or insulin resistance are at a much higher risk of developing prostate enlargement. When your body is constantly flooded with excess sugar, it contributes to systemic inflammation and hormonal imbalances that directly affect the prostate. A simple walk after eating helps your muscles absorb glucose more efficiently, reducing insulin spikes and the strain they place on your internal systems. Even more, walking helps your digestive system move more smoothly, reducing bloating and abdominal pressure that can push against the bladder and prostate. I've found that many men over 60 don't just feel better physically after walking, they feel more in control. They feel like they're actively protecting their health rather than waiting for problems to worsen. And here's the beauty of it: walking is free. No prescription, no insurance approval, no complicated routine. Just put on your shoes, step outside, and let your body do what it was made to do. If the weather isn't great, walk indoors. Use your hallway, find a mall. The key is consistency, not intensity. Start small. Even 5 minutes is better than none. Build from there. Tie it to your meals so it becomes a habit, not a chore. And if you're struggling with energy or joint stiffness, walk even slower, but keep moving. Over time, your body will be grateful, and so will your prostate. Now, we've covered how hydration and movement can make a dramatic difference, but there's still one area we haven't touched upon yet, and it's the one that most men are most reluctant to change. It's sitting right there on your plate. What you eat could be quietly healing or quietly harming your prostate every single day. Let me show you what to look for and what to avoid, starting with your very next meal. Fifth, eat for a healthy prostate. One of the most poignant moments I've experienced as a doctor came from a man named Harold, 66 years old, who sat across from me with tears in his eyes. He said, "Doc, I did everything right. I exercised, I stayed active, I even tried to manage stress, but no one ever told me the food on my plate might be the reason I'm dealing with this." His story resonated with me, not just because of the pain he was experiencing, but because he was right. Most men aren't informed that their daily diet may be one of the primary reasons their prostate is inflamed, enlarged, or under stress. The truth is, what you consume has a direct, measurable impact on your prostate health. Each and every bite either reduces inflammation and supports healing, or silently fuels the fire that causes your symptoms. And what's even more surprising is that it's often the foods we assume are harmless, or even healthy, that can slowly undermine our body's ability to heal. Let's begin with what helps. There's a powerful antioxidant called lycopene, found in red fruits like tomatoes, watermelon, and guava. Studies have shown that lycopene reduces oxidative stress in the prostate and lowers the risk of prostate cancer by as much as 28%. But you don't need to memorize numbers. You just need to know that incorporating these bright red foods into your meals is one of the easiest, most natural ways to protect yourself. Then, we have cruciferous vegetables: broccoli, cauliflower, cabbage, and Brussels sprouts. These contain compounds called sulforaphanes, which support your body's natural detoxification systems and help eliminate harmful hormones and toxins that might otherwise linger in prostate tissue. I've observed men who added just one serving a day of these vegetables noticed less pelvic discomfort, more stable urinary patterns, and even better digestion. Another often overlooked nutrient is zinc, which plays a key role in maintaining the structural integrity of the prostate. Zinc also helps balance testosterone and dihydrotestosterone, the two hormones most responsible for prostate growth. Foods rich in zinc, like pumpkin seeds, oysters, and cashews, can help regulate hormonal activity in a way that supports not just prostate function, but energy and sexual health, too. But just as important as what you add in is what you take out. Processed meats, such as sausages, deli ham, bacon, are loaded with preservatives and inflammatory fats that can directly aggravate the prostate. High-sugar foods, including baked goods, soda, and even some breakfast cereals, contribute to insulin resistance and systemic inflammation, both of which are closely tied to prostate enlargement. And I know this next one is difficult to hear, but for many men, excessive dairy, particularly whole milk and cheese, can increase estrogen levels and slow down hormone clearance, adding fuel to the fire. Now, I'm not suggesting you become a nutritionist overnight. I'm suggesting you start small. Replace one processed snack with a handful of nuts. Add one serving of broccoli to your dinner. Blend a few slices of watermelon into your morning routine. These changes, when made consistently, create a ripple effect. They reduce inflammation, they regulate hormones, they help your body heal. Food is not merely fuel, food is information. Each bite is a message to your cells, instructing them to either grow, protect, or break down. And when you begin to shift what you place on your plate, you shift the signals your body sends to your prostate. I often tell my patients, if you want to take control of your health without pills, this is where it begins. And here's the best part. When your diet supports your prostate, it also supports your brain, your heart, your metabolism, and your energy. You don't just feel better, you function better. And now that we've explored how what you eat can either inflame or heal your prostate, let's discuss something even more powerful, yet often completely ignored. It happens while you're asleep, or at least it should. Because if you're not getting this one thing right at night, your prostate never gets the opportunity to recover. Let's discuss it. 6th, sleep, your body's natural anti-inflammatory. I'll never forget a man named Ray. He was 70, a former truck driver, tough as nails, never one to complain, until sleep became his enemy. He told me, "Doc, I don't sleep more than 2 hours at a time. I'm up and down all night, and by morning, I feel like I've aged 10 years overnight." What struck me the most was that he never connected his poor sleep to the worsening prostate symptoms he was experiencing. But once we made that connection and worked to restore his rest, his entire quality of life began to shift. You see, we often think of sleep as just rest, a passive state, but it's not. Sleep is one of the most active and powerful healing processes your body engages in. And when you don't get enough of it, or when your sleep is constantly interrupted, your prostate suffers in ways you might never anticipate. During deep sleep, your body releases a series of healing hormones. Melatonin is one of them, known for its anti-inflammatory and protective effects. Then there's growth hormone, which supports tissue repair, and testosterone, which peaks during the night. All of these are essential not just for feeling rested, but for keeping your prostate tissue healthy, balanced, and resilient. When your sleep is shallow or broken, those hormones get disrupted, and that disruption manifests as inflammation, swelling, and poor urinary control. There's also cortisol, the stress hormone. When you don't sleep well, your body produces more of it, and elevated cortisol has a direct impact on the prostate. It promotes inflammation, suppresses testosterone, and keeps your entire nervous system in a state of tension. Over time, that tension accumulates, resulting in a weaker flow, more urgency, more frequent trips to the bathroom, and the cycle repeats. I often ask my older patients this simple question: when was the last time you had a week of truly restful sleep? And more often than not, they can't recall. That's not just unfortunate, it's dangerous, because chronic sleep deprivation doesn't just affect your energy, it increases your risk for aggressive prostate cancer, especially when combined with other risk factors like poor diet and lack of movement. The good news is that you can change your sleep patterns, even later in life. It starts by making your bedroom a sanctuary, cool, quiet, dark. Avoid screens for at least an hour before bed. The blue light disrupts your brain's melatonin production. Try establishing a bedtime routine that signals to your body that it's time to wind down. Light stretching, deep breathing, or even a short meditation can do wonders for your nervous system. If you eat late, shift your meals earlier in the evening. Avoid alcohol and caffeine after mid-afternoon. These small changes add up. They allow your body to settle, your bladder to remain calmer throughout the night, and your prostate to rest without constant interruption. And the difference isn't just physical. My patients tell me they wake up sharper, less anxious, and more hopeful. That's the power of deep sleep. It's like medicine you don't have to swallow. Your body already knows how to heal. You just have to give it the time and space to do it. So, if you've been dismissing sleep as a luxury, or thinking it's normal to wake up 5 times a night, I'm here to tell you that rest is not optional. It's essential, especially for your prostate. And now that we've covered everything you can do to support healing through movement, nutrition, hydration, and sleep, it's time we look at one final simple test. It takes just 10 seconds, and it can tell you whether your prostate is already under stress, even if you feel fine. Most men fail it and have no idea they're heading for trouble. Let's take a look. 7th, at-home stress test. Know if your prostate is in trouble. I remember a patient named Leonard, quiet, proud, 75 years old. He came in for a routine checkup, said he felt mostly fine, just a bit annoyed by some frequent urges during the day and a few extra nighttime trips to the bathroom. Nothing major, in his words, but I could see it in his face. He wasn't telling me everything. And so, I asked him to try a simple test right then and there. It didn't require any equipment, just a clock and a glass of water. What we discovered in those 10 minutes changed the direction of his care and likely saved him from much more serious problems down the line. You see, many men over 60 are walking around with stressed, swollen, or inflamed prostates and don't even realize it. They attribute symptoms to aging, to too much coffee, to a long day, but the truth is, the signs are often right there, hiding in plain sight. That's why I teach my patients a basic at-home test. It's quick, free, and surprisingly revealing. Here's how it works. Start with an empty bladder. Drink a full glass of water, about 8 to 10 ounces. Then, set a timer and pay attention. First, note how long it takes before you feel a strong urge to urinate. Is it 10 minutes, 20, an hour? If the urge hits you too quickly, your bladder may be overly sensitive, or your prostate may be pressing against your urethra, limiting capacity. Now, when you do go to the bathroom, time how long it takes you to empty your bladder. Does it take more than 2 minutes? Do you feel like you still have urine left inside even after you're done? Are you straining or starting and stopping midstream? These aren't just quirks, they're red flags. A healthy urinary system, especially in a man over 60, should allow for controlled filling, a strong stream, and a complete emptying without effort or delay. If you're falling short in any of these areas, it may be time to take action, because what seems like a minor nuisance now can become a serious medical issue later. Urinary retention, chronic inflammation, even infections that travel upward into the kidneys. What makes this test so powerful is that it's not about numbers or lab results. It's about learning to listen to your body. Most of us aren't taught how to do that. We wait until pain or disruption forces us to pay attention. But the men who age the best, who stay independent and active well into their 70s and 80s, are the ones who check in before things break down. Leonard's results weren't good. It took him less than 10 minutes to feel the urge and more than 2 minutes to empty his bladder slowly, with stops and starts. He admitted he'd been ignoring the signs for years, but with the right care plan, including simple changes to his daily habits, his symptoms improved dramatically in just a few months. More importantly, we caught the issue before it turned into something irreversible. So, if you haven't tried this test yet, I encourage you, don't wait. It's a small step that can offer big insight. And if your results are off, don't panic. The goal isn't to scare you, it's to empower you, because knowledge is power. And now that you've seen all the habits, routines, and hidden risks that can quietly impact your prostate health, it's time to bring it all together. In the final section, I'm going to show you how these small daily changes can add up to something much bigger, how they can transform your energy, your sleep, your confidence, and possibly even extend your life. Let's finish strong. Conclusion. Take control of your prostate health, starting today. If there's one thing I hope you take away from everything we've discussed, it's this: your prostate health isn't beyond your control. You don't have to accept poor sleep, constant urgency, or that quiet fear that something might be wrong. Small changes matter. I've seen it time and time again. Men who stop holding their urine, who approach self-pleasure with intention, who hydrate smartly, walk daily, eat with awareness, protect their sleep, and stay attuned to their bodies. These men don't just feel better, they reclaim their freedom. You deserve that freedom, too. I'm not speaking to you as someone reading from a textbook. I'm speaking to you as a doctor who has sat with thousands of men just like you. Men who were tired, worried, and ready to give up, but chose to act instead. And their lives changed. So, don't wait for a diagnosis to start caring. You've already taken the first step just by being here. Now, take the next one. Your prostate, your sleep, your energy, your manhood, they're worth protecting. And you're not alone. Let's walk this path together.